My dear colleagues and friends all around the world, special greetings to you and best wishes for a Merry Christmas and a very blessed and Happy New Year. A quick outline, I mentioned in another video just an update on Omicron and the role of the booster, particularly in curtailing it and making it, if it happens in those who are boosted, it will be a very mild disease. But I have to mention about preemptive therapy, and I think there has been a major advancement which has been overshadowed in the media, which tries to exaggerate things, about the advancements in the early treatment and preemptive treatment of COVID-19. One of the major advancements has been the monoclonal antibodies. These are synthesized, and these are two forms. One is the Regeneron, as some of you have heard, where if you give them early enough, within the 3 to 5 days early, there would be a risk reduction of 70% in hospitalization, that is severe disease, and death. And this is a major breakthrough, I think, that has happened in 2021. The other one is the BAM Etesevimab, and this one is a combination by Eli Lilly, and that would result in a significant reduction also in progression of the disease, because as you will know, COVID-19 starts with a mild disease in everybody, including the high-risk people, that is the elderly, immune-compromised, and otherwise, but it progresses within 5 days in these high-risk patients to severe disease and possibly death in around 10% of these high-risk people. Although the mortality rate is lower, is around 2% in lower high risk, with low risk. So the other breakthrough, besides those, because these are expensive treatments, are now the promising oral antivirals. And these are two classes, and the importance of those, these are less expensive. The first one is molnupiravir, which received emergency use authorization more recently. It's a nucleoside analog that inhibits SARS-CoV-2 replication. And it applies to all the variants, including Omicron. And in a study of 1,400 patients, it reduced the risk of progression by 30%. It was significant, but as you well know, 30% is not that great, but it received emergency use authorization. The other more promising drug is Paxlovid, which is a protease inhibitor. It's a combination that includes ritonavir and could be used, as you well know, ritonavir is quite used in HIV infections. In a study on more than 1,200 patients, if it's given within 3 days or within 5 days, it reduced the risk of progression to 89%. Remember, 89% compared to 30% for molnupiravir, which is a major advancement, in my opinion. And this is a very promising drug. I want to share that with you, not in terms of an investment. I just want to tell our physician colleagues that this would be the promise for the future in 2022. Because if we're having breakthrough infections in high-risk patients, despite the vaccine, with waning immunity, these new antivirals, particularly Paxlovid, would really become like the Tamiflu with influenza, where you can preempt a progression to severe disease and death in this high-risk patient population, and make it become a manageable infection with a very low mortality. I would like to end this brief video with special greetings and salams to each one of you, my colleagues all around the world, and especially in my homeland of origin. Have a Happy New Year and a very Merry Christmas.